All right, here we are for another Culture of Care Conversations. I'm so excited for today because I get to talk with my good friend Lauren of Thrive Physical Therapy, and pleasure of working with her for both of my pregnancies. And she will be here right now. There she is. Hey, Lauren.
Hi.
How are you?
I'm pretty good. How are you?
Good. I was just saying I was excited to have you with us today because we go way back. We met when I was pregnant with my first. So we're going on
I know.
7 years. She just turned 6, by the way.
Oh my gosh.
No.
That's wild. Wild.
Yeah. Yes. So I was one of many women who didn't know what my pelvic floor was until I met Lauren about 6.5 years ago. And then I got to work with her again with my second pregnancy about 3 years ago. And yeah, she's just a wonderful human and an amazing practitioner. And in this series that we're talking about, the culture of care and what it means to care for mama and what self-care looks like, we know it takes many forms. And I do believe that this work in connecting with our bodies and understanding what our bodies do, where things are, how we can best support ourselves, it's just so super important. And so that's why I wanted to have you on today. I'm so happy that you joined us today. And so really that's what I want to do. I want to pass it over to you to share a little bit about who you are, what you do, and then we can just dive into, the pelvic floor. What is it? Where is it? What do we do?
Sweet. My favorite part. Yeah. Interrupt if you have any specific questions that you want to make sure that I get across to the people.
Yes.
Because I'll just start.
Also chime in too. I'm keeping an eye on the chat. So any questions, I'll let you know too.
Perfect. Okay. Hi, I'm Lauren. I'm a doctor of physical therapy. I've been doing pelvic health or pelvic floor physical therapy. You will hear both of those terms for 12 years. And that's as long as I've been a PT. I was a regular, quote unquote, regular orthopedic physical therapist for like 3 months before I started working into the pelvic floor world. Basically, 2 things happen. I'm an oversharer, so people would be very comfortable to share with me, like, oh yeah, I peed my pants the other day, or like it hurts to have sex. And then the second thing was I was just getting more and more of those stories and getting like pissed, just actually angry that in particular. So pelvic floors, this model will go over that model. Pelvic floor, their muscles in your pelvis. So like everyone has a pelvic floor, and people who have carried and birthed babies usually have come more into contact with their pelvic floor, so they're talking about it more often. So in this particular case, in my first job, I was just getting more and more stories from everyone. And I'm like, oh, cool. So thank you for your service, for bringing this human into our world. And so we have nothing to help you. Like that just pissed me off. So then I went down the whole rabbit hole of pelvic floor therapy, because that's a whole like postdoctorate training thing. So I've had Thrive Physical Therapy with my husband here in San Diego for 6.5 years. But like I said, I've been doing it for 12 years. So that's what got me into it. I now have a 14-month-old little baby boy, so I can understand it from a different perspective as well. But in addition to being a pelvic floor physical therapist, I've also done a lot of training in the birth world. So as like a postpartum doula and innate traditions in like the postpartum birth and healing world. So both like the sciencey side and then the more like birth side of things. So if you have any other questions, ask me, but that's who I am. Let's start with the pelvic floor. So I'm a pelvic floor physical therapist, or like I said, pelvic health physical therapist, because if you have, I'm gonna grab the thing. If you have any issues relating to pee, poop, or sex, you would probably be working with a pelvic floor or pelvic health physical therapist. And I think the reason sometimes I say pelvic health physical therapist is because we don't always have to work like directly on these muscles of which make up the pelvic floor. there are so many other things that impact the health of your pelvic floor or pelvic area, your bladder, and all of that, such like the foods that you eat and drink. Like if you find yourself peeing often, it might be something that you're eating or drinking that's an irritant and have nothing to actually do with your muscles of the pelvic floor. So I digress. But here's our pelvis. I just took out all the organs. Let me grab them again. Pee, this is the bladder. Poop, this is the colon. And then the rectum. And then sex, if you're having sex with vagina, with using the vagina, here's the vagina, because you don't have to have anything in the vagina to have sex. That's a whole other topic that we will have to talk about.
Lauren, that's a part two. We don't have
the part two already. See, sex and pleasure, I guess we can say are different things. But anyway, here's the vaginal canal up to the uterus, fallopian tubes, and ovaries. So they all are positioned like this. So this is facing forward. This is facing to the side. Okay? And they all go, I know you can't see this right now, but I'm just going to stuff them in here. They all go live within the pelvis. So that's the colon where there's poop, baby, and then bladder is under there. So like if you've ever been pregnant and feel like the baby's bouncing on your bladder, like they probably are, amongst other pelvic floor things. But so here's the pelvis, and it holds all of our organs, right? The lower part of our pelvis holds in our organs. I think something that's interesting is like your uterus is like practically behind your pubic bone. I feel like I always thought it was like higher. Mm-hmm. When you're pregnant, it becomes 40 times bigger. So it is higher, but you know, as you're sitting right now, the uterus and bladder are behind your pubic bone, pretty low. So here's like one pelvic bone, the other one. Here's your pubic bone in the center. This is your spine. This is just the bottom portion of the spine. If I was laying on my back with my knees up, I'd be looking this direction. Here's your two butt bones, your sit bones. Okay, and then we have three holes. The urethra, where your pee comes out, the vagina, where baby comes out, if you have a vaginal birth, or you have belly birth. And then the butthole. Okay, close up of that. But the pelvic bowl, you can think so pelvic floor, aka also pelvic bowl, because it literally looks like a bowl of muscles that holds all your organs. So it has three layers. The first layer are these like triangle muscles that are responsible for closing. The second layer, I'm going to take this off, is like sphincters and like fascia. And the third layer is the bowl part. Okay, so if you've ever done a Kegel or heard of a Kegel, which aka push-ups, we call them push-ups here because we're over Dr. Kegel, like you had your time. But when you do a push-up, you do like a close and a lift, right? So you would do close and then lift. Also, just for like reference, that's your tailbone. So these muscles attach on the inside to the pubic bone and then also to the tailbone in the back. And they wrap around the vagina, they wrap around the rectum, the anus. So sacrum. You can see that the pelvic floor is central to your whole body, right? So it can affect how your hips feel, how your posture is, how good your core turns on or off, right? And then it can also be affected by your hips and your core and your spine because they're all next to each other. I'm going to stop there, I think, unless there's anything else. I'm avoiding talking about the clitoris right now because I think this is just going to be a whole different story. I guess I should give you also, let me make sure I do this. The skin is not on here, obviously, but if there were skin, these would be the external labia and then the internal labia here, okay? You've probably heard them before as majora and minora, labia majora and minora, okay? If you're looking at this or talking about this picture, this is called your vulva. This tube is the vagina. So we can already, start using that language and teaching that language because that's just correct. You can't really see people's vaginas.
And I love this because what we've talked about many times, and I think because these conversations conversations are happening more thanks to you and others doing this important work. It's like women realize that, and probably men too, we don't know what's there
Yeah.
because being told, like, literally no one has walked through the pelvic floor, the bowl, the everything, and the way you're talking about it. And I just think this kind of just baseline anatomy conversation and education is so critical to not only to being able to connect with our bodies, understand our bodies, but also to take care of ourselves if we don't know
Yeah.
what's down there, if we don't understand how it's all connected. And I'm not talking about, I mean, caring and birthing humans is a whole other thing, right? But like even without that, it's still, we still all have
Oh,
it.
totally.
Uh,
Yeah,
but
like I was saying, like, yeah, everyone has a pelvic floor. And like my first patient ever was 21 and she had never been pregnant or anything. So yeah, it has. And then I also used to treat men. I don't treat men anymore, but we all have them. They are just muscles like our other muscles. They
mhm.
just are in a cave, right?
Yeah.
So it's like harder for ourselves to understand what's going on. Like if our upper traps are tight, like we kind of know, right? Or if we have like a knot in our back or something, like we know that's there. It's hard to sometimes know if you have a knot, a tight spot in your pelvic floor muscles, or if the pelvic floor muscles are not as strong as, you know, if your calf was weak or something. That's just much easier, um, easier to find out. It's all, and we've learned about that. Like this, I call it body literacy, like having body literacy and the words to be able to describe something to yourself, to your partner, to your provider. That's, hey, I actually know a little bit about my parts and I can tell you, and that means then you can tell me, so they can just, I'm speaking about providers in particular, so things don't just get glanced over, because that's another thing in our world, is we've actually been taught to ignore this area or feel shameful of this area or wash this area. That's a whole other. You don't wash your vagina. You can wash out here, but don't wash your vagina or on the inside of the inner labia.
See,
But
we need all the PSAs. We need all from Dr. Lauren multiple times over and over again just to reinforce. But yeah, and I mean, of course, caring for mama, we are connecting with a lot of mamas and women and people who are supporting mamas. And I think it's also not only getting to know and supporting our own bodies, practicing self-care in these ways, and also educating our children. For those of us, I have two girls, so if I don't understand, I can't help them understand either. So it is this passing on of generations too, because
yeah,
if they're not getting school, if they're not getting it in their environment, we can empower our children from home too. So I love that part, personally, since I have girls.
yeah,
Okay, so speaking of care and so talk to us a little bit more about what it looks like to actually like understand what's going on down there, what little exercises we can do. I know we talked about one example, maybe we can walk through it now, um, so that we know what to feel for, or
where
what.
you are,
Yeah,
like where,
like, so if I'm
yeah,
do I
yeah.
need help from a Dr. Lauren, or what's really going on down there?
Yeah. Okay. So, like I said, I work with a lot of people who have some issue with something having to do with pee, poop, or sex. So, first of all, if you have something like that, like you pee your pants, or you have pain with penetration, or not with penetration, just with touching, or you accidentally like pass gas, come my way. If you don't have any of those issues, great. And maybe it's good to know where your pelvic floor is at, because your pelvic floor is also part of your core. So if you're wanting to have a full, strong core and full strength, it would be nice to know where your pelvic floor is at. And where your pelvic floor is at is in your body. But we can kind of like break it down to two things. Are the muscles within that pelvic floor, the pelvic bowl, are they really high tone or low tone? Like, are they overly tight, which actually this overly tight muscle renders the muscles weak. So tight does not equal strong. It's like if your upper traps, or if your bicep was really tight, like, hey, if your bicep was really tight and you needed to like do something like hold a bag, you couldn't do that, right? It's not functional. So it's like rendered weak because it's just already tight. And so think about those Kegels or the push-ups. You wouldn't want to go do more push-ups or more bicep curls because it's already an issue. So if you're that like high and tight person, you need to know that because you need to be doing certain things. If you're on the other side where your pelvic floor muscles are kind of like low and chilling and they're like, I don't really want to respond to you. They're also not responding, right? These are not responding to you because they're all freaking stressed out. These are not responding because they're like very much so not stressed out, like lax, right? So like, which one are you? Would be really great to know so you know what to do for it. Okay, like this person, you can imagine might benefit from some push-ups if they're done the right way. So, and all of your ability to do a push-up that close, lift, and then also let it back down, and also stretch and like lengthen the pelvic floor muscles. Those three positions are very important to have in order to have good pelvic floor function. So you don't have the pain, so you don't have urinary leaking, so you don't have accidental gas leakage, okay? You want to be able to do contract, relax, and lengthen. So if you, let's say, okay, wherever you are, we're gonna do a little thing to see if you can feel those three positions. So let me explain them again first. We have, I'm gonna switch the order on you because we're gonna do it with our breath. So we're gonna inhale and fill your whole body with air. So your chest, your belly, and also your pelvic floor, your pelvis, your pelvic bowl, fill that with air too. So as you inhale, you want to think of like you are a balloon and you're getting expanded. That's going to be the stretch part of the pelvic floor. And then you're going to exhale, close the vaginal opening if you have a vagina, and lift. And that's on the exhale. And then you're just going to relax. Okay? When you relax, it goes down to that baseline. So we have those three positions. They're just a little bit out of order from what I said before because we have to breathe. So we're going to go. You can keep your eyes open if you want to watch my hand. This is where your pelvic floor is going to go. Inhale. Pelvic floor is going to stretch down. Exhale. Close and lift. Keep it up there. Hold it up there. And then relax. Let it go back down to its baseline. When you're closing and lifting, that's the push-up part. You can think of closing your butt bones and then lifting up. Like I said, if you have a vagina and labia, you can think of closing the labia and lifting. If you have a scrotum, you can think of lifting the scrotum up, closing your butt bones first maybe, and then lifting the scrotum up on the exhale. That's the push-up part or the scrotum up part. One more time. Inhale, everything lengthens out. Exhale, everything closes and lifts. And then you just relax back down to your baseline. If you can feel those three things, yay, fantastic. You probably have good excursion, is what I call it, good excursion of your pelvic floor. If you didn't feel those things, it might be helpful to like literally like sit on your hands so you can palpate like the muscles here, or you can like roll up a towel and sit on it. This is not a towel, and sit on it like long ways. So you're straddling it just so something is touching those muscles and maybe give you a little bit more feedback if you can't just feel them moving in space. If you don't know what's going on, that's more common than being able to feel all those three things. That's where pelvic floor physical therapist can help you out. And we can either do like an external palpation. So like if you're wearing, like spandex pants, we can put our hand here and just put pressure onto the muscles so we can feel if you're getting that lengthening and that contraction. We can really only feel this first layer when we're doing an external like that. It's a little bit harder to feel the third layer, right? Because it's like way deep in there. And so a more like accurate way is when we do like an internal vaginal assessment. So I can't fit in here, but we put our finger into the vagina and then we can feel the different muscles for their tone. Are you this person or this person? And then for your strength and your ability to lengthen. So can you do all three of those positions? The lengthen, the push up, and then the back down to regular, to your baseline.
Yes, and
either way.
Oh,
What's
sorry,
up?
go ahead.
I was gonna say either either way, like if you don't feel it, I think it's still like a good thing that you can't really like, since you can't really like do too much of these. I will say though, if you are unsure if you're doing the push up and you're actually like, because I find this often, people think they're doing the push up and they're actually pushing down. That's not so great, right? Like maybe, especially if you're someone who has like, if you've heard of prolapse or like heaviness in the vagina, and you're pushing down when you're intending to pull up, like that's not a good combo, right? So this little breathing thing is a way to assess it. But I should step back and say, actually, if you can't feel it, ask someone for help, a pelvic health physical therapist, so you don't continue to just keep doing it the quote unquote wrong way if it is. We don't know, but neither do you. So,
But someone who can help
yeah.
assess what's actually happening. No, I love that. And also, speaking of the core connection, because I know for me, just learning that movement, like the counterintuitive, relax,
Yeah.
breathe in, and then pull in.
Engage when you exhale.
Wild to understand that, like it was a mind body confusion thing. But after my second daughter, I had a pretty large diastasis recti, a DR we like to call it, and so I know that's something you also support with and you
Yeah.
work on, because right, it's all, I mean,
It's all
it's all
connected. Yeah. You're,
connected. So maybe you can, I know we don't have too much more time, but maybe you could touch on that piece too, because that kind of zipping up the internal core as well as the push up, like you
yeah,
say, that kind of goes together, right?
totally. Yeah, totally. Thanks for bringing that up. So if you've been pregnant, to 37 weeks, 36 weeks, sorry, I can't remember the studies, then you have had diastasis. So everyone who's pregnant, to full term has diastasis because you just have to. And diastasis recti, or diastasis, you could say however you want, is just like there's a fascial line down the center of our abdomen and it gets stretched because you're stretching, right? So that, and you hear it as a separation. There's still tissue there. So I like to say that it's stretched, right? But because it is stretched, it's not as strong there, and it doesn't just like hold your core together like it maybe did before. You have to like do more about it now. And our trunk, like from our diaphragm to our, you can't see my hand, but pelvic floor, and then our core, it all kind of acts like a vacuum. So meaning, or like, you can think of it like a soda can. If you like pop the top of the soda can, the tension is gone, right? You could pour the soda out. If you made a slit like diastasis recti down the center, the soda can come out. Or if you popped a hole in the bottom, aka the pelvic floor, soda can come out, right? We want to keep everything nice and intact and working with one another, which is how the pelvic floor and the core work together. So just like Kim said, like zipping up, I think that's a great way of picturing it. Zipping up, like, but instead of just straight up, like if we're just going a zipper, like in our pants straight up, we're actually going to go zipper from like the back, like from the butthole to the vagina, up the front of the clitoris, and then up to the core. Okay. I use different cues. The zip doesn't always work for everyone, but it's a very good one. So if you do the same thing we did before with the inhale and then the exhale push up, you're just going to keep that push up going and zip up your core as well. And I like, if you had a belly birth, it'd be a really good idea to put your fingers along the cesarean scar and try to get that mind body connection pumping and get that part moving as well. Because oftentimes it doesn't move as well because, there's a scar there. There's like stuff that happened. So our brains are like, no, I'm good. I'm not going to move there. Or if you have diastasis that's like bigger in a certain area. So myself, I also had a pretty big diastasis. And so mine was like bigger right at my belly button. Jeez. So I benefit from putting my fingers right at my belly button, and then get my hand out of the way, and I can't even see that. And like working bottom to top, but reminding myself to do it right here in specific. And I think it's really nice to put your fingers there. It like helps that brain to body connection. So I hope that answered that.
Yeah, you're just I just love you're just such a great teacher. It's
Oh,
one thing
thanks.
to be it's one thing to know about the anatomy, be able to work with clients and patients and like help them through, but to also be able to educate is such a huge yeah, I'm just grateful to know and to have worked with you and to be able to share your yeah, your expertise with more people. Because I do believe, and like we talked about, and the reason why I was excited for you to join, because I love you, and because the I do believe that this is an important form of self care.
Well,
We talked about like it's self care can be lots of
all
different things.
yeah.
It can be writing in your journal in the middle of the night, like I do. It can be stepping outside and putting your feet in the grass and taking a few deep breaths. It can be going to get a pedicure. It can be, but it can also be taking these mindful breaths and connecting with your
Yeah.
body. The better we can connect with our bodies, the better we can start to feel. And, when we're feeling well physically, um, it connects with other well-being aspects, right? So
Yeah. And I know like
as a way, connecting it more directly to self-care, because that's what we're talking about with these boxes that we're putting together. It's really reminding women that our needs, our self-care really does matter. And so bringing to light different ways of care is really important. So
yeah, and I know like this whole series, right? It's like streaming across right now. It's called Culture of Care. And like the culture of physical therapy in general, not just pelvic floor physical therapy, but the culture of physical therapy is movement and getting you to be able to do what the heck you want to do, right? And as a pregnant and postpartum person, those things that you used to do usually change, right? Like you usually aren't doing the same exact workout. Let's just use that simply, right? Because your body is changing. And so I really love being that like bridge between your new body and feeling strong and confident in that new body, and not even like having this thought of going back, like, oh, I want to get, I don't even like saying, oh, I want to get back to Pilates. Okay. So you want to go to Pilates. You want to
yeah.
go to Pilates, but they're like, we don't need to go back
Mm,
because you can also be strong in this body.
yes.
And I know it's different, and we only have one reference point, right, of ourselves. There was like that version and this version. Um, so I don't know. It's just, as far as like the culture of care, like to care for the whole world, the people who are raising our children need to be like doing well,
Mm-hmm.
right? And if your body is hurting, or if you're embarrassed because you just laughed with your girlfriend and now your pants are wet because you leaked,
Mm-hmm.
like that doesn't feel good, and like now you're taking that into the world, into your children. Not that you're going to be like, oh, I'm mad, I'm, just peed my pants or whatever, but we all know what that feels like when
Yeah.
you're not feeling good about yourself, you're not feeling confident, and you're not feeling like, in particular, in my physical therapy world, strong. And you're, sometimes it's hard to just like keep on going. You're like, oh man, my brain's on all these other things. So I want to take that part away for people. And just,
Yes. And I I know firsthand how important it is, and I'm excited to get this out to more women who may not have access or may not even be aware, first of all, pelvic floor, number one, within their own bodies, but knowing that there are people like you out there who specialize in this work and can actually help them understand what's going on if there's confusion,
yeah,
or getting more acquainted there, but also having these small exercises to try at home. So we'll have that as a tool now. And then I'd also love for you to share how people can find you. I was looking back on your site, and I see that you do have a bunch of free resources. It looks like you have
mm-hmm.
as well. So for those who are in San Diego and can actually get to Lauren, she's in the Bankers Hill neighborhood. It's Thrive SD, right?
Thrive Physical
ThriveSD.com.
Therapy, San Diego. Yep.
And the website's ThriveSD.com.
The other way around, sdthrive.com,
Oh,
but it's
SD
all
Thrive.
good.
I will put it.
It was taken.
Anyway, she's in the Bakersfield neighborhood, so you're always, welcome to go in and see her in person. But maybe you could share just a little bit too about what resources you have online for those who aren't in San Diego.
Yeah, for sure. So we do see, and I'm saying we because Dr. Rowena is another pelvic floor physical therapist here. There's two of us that you can work with. If you look online, we kind of look similar. So we can see you virtually as well, because a lot of this is education, right? We are not going to be like, put your vulva up on the screen. And like, that's not what it's about. I might, have you breathing and we're practicing exercises and I'm watching you do the exercise, because we can see a lot of your mechanics and stuff without having to actually like feel them, like I was talking about earlier. But anyway, so we can see you virtually. And then we have a whole bunch of 4 webinars. The whole series is called Muff and Stuff. Muff as in pubic hair. Also, we named their dog Muff, so you'll see her little face on there. But it has 4 different webinars. You can get them individually or all together, and we go over pelvic floor basics. So this was like one small part of that. It goes deeper, and then there is one on leaking and prolapse, and then there's one on diastasis recti, the core thing Kim and I were talking about, and then the last one is on pleasure and like bringing pleasure back into your life. And if it's not bringing it back, we can talk about that, bringing it forward and like increasing it even more, right? And in that, we do talk about pain with intercourse or pain with penetration, because that's a mood killer for sure.
Yes, and talk about because we try to keep these a little bit short, but that deserves its own topic, its own live. So we will have part 2 with Dr. Lauren in the new year. Stay tuned for that, where we can address the pleasure piece of the pelvic floor and how to navigate that world.
Yeah.
It is an area that I don't think we're talking about enough, and as many forums as we can have that conversation, I think it's really important, because talk about another form of self-care, feeling pleasure in our life, like that's so
it's huge. Yeah. And I like left it out of the anatomy. I was telling Kim that like when I go over anatomy, I always talk about the clitoris. So I'm gonna just quit. Like literally, I'm just gonna show it to you. So here's a different vulva, and then here's the clitoris. This is the whole clitoris, right? Oftentimes we only know about this little piece, but this is the whole clitoris. Okay, that's all I'll say about it. But I was telling Kim that when I do that part, it like, and then we want to start talking about the importance of the clitoris and how its anatomy and its engorgement contributes to pleasure or first, like pleasure, and then also no pain or less pain with sex and all of that. So I gave her the heads up, so I left it out. But yeah, we have to just do a whole thing on it, because it's
part 2. Yeah, because it's that important. And I think that will bring us to the close of this live, which I don't want it to be the end. But is there anything we didn't talk about that you wanna share before we close?
Let me see. I wrote some little notes. Let me see. Oh, I just wrote myself a note because we were talking about self-care. Have you ever heard, this is like a question for you, have you heard of the book Soul Modes?
Soul Modes?
Uh-huh. It made me think of when you're talking about how self-care is different for everyone. It doesn't have to be a massage. A massage might be actually annoying to you because you have to go and do other stuff.
Yeah.
So anyway, I have the book here. It just talks more to like, it's so individual per person, what your self-care is, and it also can be so individual per where you are in your life at that moment. If you're like, okay, I'm in like superwoman mode, I have to get all this stuff done, you're not going to sit down and have a glass of tea.
Right.
That's going to be annoying, right? So if you're in
like steeping and the whole thing,
yeah. So anyway, that was only like little thing. And other resources is we have gift cards. That was Like that was new. We used
Yeah.
to just do gift certificates, but we have actual gift cards you can get for people in your lives.
Well, I'm going to add all of this into the caption when we share this out. I'll also share it on the YouTube channel that I'm going to start building out a bit more so you can see the whole video, because in the reel it won't show the whole thing. So
Right.
anyway, so grateful for you, Lauren.
Yeah.
So grateful
Thank
for
you. Me too.
you, and stay tuned for our next
And yeah,
installment.
next, yeah, the pleasure in the pelvic floor, whatever we're gonna call
Pelvic floor. All right, my
it.
dear. We'll
Thanks
have,
for having me, Kim.
of course, we'll talk to you soon.
Okay.
Bye, everyone.